Good afternoon, Dr. Theo Hensley with you here today on the Dr. Theo Show. Hopefully you guys can hear me this time. Thanks for the feedback there on the last one. Much helpful. We're going to be doing something a little bit new and different today as far as perspectives go. If you guys have been tuning in here over time, then you'll have seen that I've been trying to have a few different perspectives and a few different people here on the Dr. Theo Show to show folks locally here in Greene County that it's not just me saying certain things about coronavirus COVID-19, but that there's other smart people like my guest here today, Dr. Ken Nickle. Now, Dr. Ken, I know you well, but if you don't mind, can you introduce yourself a little bit about you and your background?
I sure can. I'm Dr. Ken Nickle. I'm from Tusculum Family Physicians there in Greeneville on Justice Drive. I'm part of the Summit Medical Group, Family Medicine Board certified, and right now I am actually talking to you from East Connecticut, where I am assisting with treating COVID patients due to the large number of people that have been affected up in this area.
Okay, so East Connecticut. Now, my geography memory is slightly hazy after a few decades from high school and so forth. How are you in a hot spot up there or close to other areas, or what kind of places are you serving at right now?
So I am in a hot spot, actually. I can see the New York City skyline from where I'm at. I'm about 5 miles from New York City. I'm in a community where many of the people that live in this community actually commute down to New York City and work there. So it's a highly populous area, and it's been hit the hardest in Connecticut.
Okay, so you're a physician serving through the Army Reserve. Is that correct?
That is correct, actually. I am up here with the Army Reserve, but of course, always the caveat. What I discussed today is actually my professional opinion, and my opinion only. Is not in reference to the U.S. Army Reserve's opinions and what they would say.
Oh, sure. Well, absolutely. Well, in case there are any other Army or government officials, hello, and thank you for everything that you do. And Dr. Ken, thank you very much for your service, not only locally here in Greeneville, but also to our country as well. So what I'd like to do is a lot of the people that are following my Dr. Theo show here, they hear my point of view and how serious that I think coronavirus is, but also over the past few weeks, we've been learning a whole lot more. So we know more today than we did 2 or 3 weeks ago. Here locally, we've got a whole lot better access to screening and testing than we did just a few weeks ago. So at least I'm a little bit reassured of that, because we can track and see how many cases there are. Now, since you've gone to active duty there, we have roughly 44 or 45 cases here in Greene County, and that seems to be plateaued. And so we're just now reopening up indoor restaurants. They're sitting at 50% capacity roughly, but really people are kind of getting out and rustling and bustling. And one of the biggest concerns that I've had is there's still a lot of people that aren't taking this seriously, or this wasn't as bad as what was predicted, which of course those of us in medicine say, well, of course it wasn't as bad. We prescribed a treatment which was social distancing and staying away from each other and being careful while we were building up a mask supply and figure out treatment options and getting prepared, building ventilators and those types of things. But I feel like the average Greene County in here says, oh, well, this was just this conspiracy. It's not real. We heard that a lot of people were going to die, more so than already have. And that's my biggest concern, is how to get back to business, which I'm working on through a couple other projects, but how to get back to business safely while not putting people at risk. And I feel like that when people are watching television, they watch CNN, MSNBC, Fox News, whatever way they got. When they hear other doctors, they don't know that they're just not getting that sense of trust. Whereas hopefully you're a really smart doctor and you're local, and some people may know you, some people don't. But one of my fellow Summit colleagues here in Greeneville, that's a non-ballot group, by the way, in case for those of you who are counting at home, but that, hey, here's some local smart people with varying experience. And of course, once again, you have direct hands-on. So if you can, tell me a little bit about what you're seeing on the front lines, and we'll go from there.
Yeah, I sure can. I can definitely tell you the COVID virus is very real. It's hit many people in the higher density locations a whole lot worse. People that are in very crowded areas, it is definitely looking at the population that gets affected the most, it is the people that are a little older and with comorbid or other medical problems. Younger people have some safety, which is nice, but a big thing, and I think learning up here very much, is that even though younger people do in most cases tend to have a lot better ability to fight the virus when they get it, people still do end up going to see their parents and their grandparents. And it's that factor that makes this so real, of having to really think about what you're doing and trying to abide by a lot of our basic guidelines of the social distancing. Fortunately, in places with lower populations, whether it's back home there where I sure wish I was right now, but
it is beautiful here right now, by
yes.
the way, Ken. I just got done playing 9 holes at Twin Creeks Golf Course, and holy cow, perfect weather, 75 degrees, little breeze, like two clouds in the sky, and of course, what better way to distance at a golf course for social distancing, right? Of course, when I hit the ball, I'm way off in multiple fairways, so sometimes I get a little closer to other people than I'd like to. But yeah, we would love to have you back home.
Well, I definitely am counting the days. Hopefully I'll be back soon. But in the meantime, it is definitely an important thing to sort of work on keeping distance. It's good to get back outside because that's actually very important. As we're seeing here, particularly people that have been inside for so long have a heck of a lot more problems with becoming depressed and other psychological issues. But being sure, as we're all going back to normal business again, which hopefully will turn out very well, that we just keep in mind keeping the basic hand washing, which I know you've expounded many a times, keeping just basic distance. And that doesn't mean you have to be miles away from people. If you do have to be close, that mask is good. But as long as you're staying far away, more than that 6 feet, which is the recommended, which is what the virus has been shown to be able to sort of go forward when people are breathing it out. You don't necessarily need a mask everywhere. And we have people out here even that everyone has a mask up in this area, but people still are out on the streets. And as long as they're staying separated, people keep masks off because no one wants masks if they don't have to.
Oh, sure. That's a good point. I've had a whole lot of questions about that. And I even have some patients that are washing their hands 50 times a day and they're not even around anybody else. And I say, listen, you don't have to do that. I mean, if you use the bathroom or something else like that, sure, by all means. But, you can safely be within your house. You can go outside. You can go for a walk. You can wave at your neighbors. And for those things, you don't need a mask unless you have terrible allergies like I do this time of year. But otherwise, yeah, the times you want that mask is when you're going to be potentially anywhere close to 6 feet away from someone, especially
right.
in indoor settings, right? So if you're going to a local grocery store, which some of those here locally have directional arrows so that you don't even have to get too close with people, but that if there was someone coughing, or if you were coughing, that mask kind of helps catch any other kind of spit or some particles, not everything, when you're in that close contact. Now, if you don't mind, Ken, if you can tell me, being on the front lines like you are, we've talked briefly so far as what people can do and staying at home and getting out and getting some fresh air. But what are you seeing in the hospitals right now? Is it like what we're seeing in the news? Is it completely opposite of that? I mean, what are you seeing there in a hot spot?
So I've been here now for about a month, and fortunately, it's calming down, which is really good. But I'm situated in a hospital where we had 2 floors dedicated to COVID virus patients, as well as an ICU dedicated to people with COVID virus because it is communicable and they've kept away. There are a lot of people up here that have developed COVID virus, and we've been filled in the hospital wards. So even now, fortunately, we're down to just 1 floor in the hospital that I'm in. Our wards are still full on that floor, so there's still a good amount of people having a problem.
Now, do you feel like you have access to an adequate amount of protective equipment, masks, gowns, and those types of things that you need to keep you safe?
So part of it, yes. We have plenty of gloves. We have plenty of the regular surgical masks that we have around all the time. But as far as the N95s, there's some limitations. So we do have a good amount, but there are some rules. We usually actually sterilize them 5 times before we throw them away and sterilize them after each shift. As far as our gowns, that's probably the biggest limiter. Gowns are in very short supply, so we have to be very careful for the amount of times we go in to see patients that have this problem. But I think things are getting better. There's still limitations, though.
Sure. Now, are you seeing other doctors, nurses, respiratory therapists, nurse anesthetists, anybody else as far as staff getting sick yet? Or how's that looking in your particular area?
So most definitely, I think that, we've had on our ward at least 5 physicians that have come through just my ward alone, of varying specialties. Some of the people I've come up here with have developed the COVID virus. So fortunately, the group I've come up here with has been a healthy group, and everyone has done very well that has developed it, but it's definitely taken them out of work.
Absolutely. That's been one of my big concerns, too, is protecting our healers. Like you, first lines, or me, maybe second lines here. Hopefully, by the time you get back, you'll find I've done a fundraiser for Greeneville where we had a lot of citizens or businesses chip in. And as of right now, our office has purchased a bulk order of N95 masks, and we've raised close to $2,000, which is just about enough to where the ballpark 40 medical offices here in Greene County, we're in the process of donating a box of 20 N95 masks to each office for that purpose, for the frontline doctors, nurse practitioners, physician assistants, nurses, medical assistants, you name it. We only have one shipment in so far, and we've got several others coming through customs, but I'm hoping by the time you get back, you'll have that there too, because I think one thing that we're all hearing, and one thing I've been nervous about is, hey, there's some people out there that are asymptomatic or pre-symptomatic, and of course right now here in East Tennessee we're in the middle of allergy season, so if you are pre-symptomatic and you happen to be coughing or sneezing anyways, that's a way potentially that the virus could kind of get out and spread. So it's that kind of calm before the storm, really, where we don't know quite who is going to be the most contagious or the least contagious. Is it that young person that comes in with the sniffles or some unrelated complaint that's potentially at risk? And of course, shout out and prayers to our colleague, Dr. Lewis, still in the hospital. Hey, Danny, we love you. We miss you and your leadership, and we can't wait to have you back amongst our ranks. So we're thinking and praying of you, with you and for you in your recovery now, already a month in. And it's those kind of stories that for me that really hit home is, hey, that could be me. That could be you, right? Someone who's otherwise younger, healthy, not that necessarily 80-year-old we're hearing about on television that's having this rough time, is this can hit anybody. Now, you mentioned some demographics in the hospital and that numbers are coming down, probably from, I would assume, from the mitigation response up there, which is going to be more strict than down here. Are you having any atypical cases or people that you're surprised that are sick or anything else like that? Or is it typically people with chronic health conditions or the elderly?
Well, I can definitely tell you that most of the people that I see are over 60 and have other health problems. Not all, we have seen some over 60 that just on their own, but we have seen a few atypicals that are younger, healthier people. Now I can, just for relative purposes, I've seen quite a bit of people with COVID virus now, but just off the top of my head, I can think of 4 or 5 cases that don't fit those demographics.
Sure. So essentially, and I think what I've read at least is that roughly 90% of people hospitalized have at least one chronic comorbid condition, which kind of a vague statement, but just to translate it for anybody who's watching, that means diabetes, high blood pressure, chronic lung disease, maybe even chronic kidney disease, heart disease, essentially at least one organ system that's dysfunctional in some way. But on the flip side of that, I've talked a lot about the numbers dying and the numbers affected and everything, at least locally and nationally. Are you seeing a decent amount of people making it out of the hospital, making it off of a ventilator, or what happens once they get there, and about how long is it until maybe they leave the hospital?
Well, unfortunately, I think people that get to ventilators, there's not a good amount of people that come off ventilators. I think it's averaging, I think you can look across this nationally, 50%. So there are a lot of people on there that have been on there for a long time. But I think at this point in time, we're getting a lot of people out that are recovering. It's really an amazing disease because people get very sick, the ones that come in, but once they can get their foothold again and they can get themselves starting to get better, we see them walk out of the hospital within 3 or 4 days after they turn the corner. Sure. Some still requiring oxygen, but it's getting to that period of turning that corner is really the tough part.
Well, right, and that's kind of spot on from what I'm hearing from some other people, at least that I know and I've read from frontline accounts. And that's, I think, always one of the tricky things is you hear one thing from one news source and something else from someone else, and we don't know really what the truth is there, because the truth's always there somewhere in between. So some people getting through this pretty well, some people just continuing getting worse. Now, one thing that I'm reading and hearing both from folks like Dr. Lewis in the hospital as well as other people around the country is this day 9, day 10, 11 type of thing where people are otherwise mildly ill, maybe flu-like, and then it just seems like they crash. Can you tell me a little bit about that?
Yeah, that's very real. I think that there are some people that come in real bad that have just started to develop, but most people that really get into the bad way after symptom onset, it's usually, like you said, between 6 and 10 days that they really hit that wall and they crash, and we see a lot of difficulty through there. And that often will last up until once that crash occurs, hopefully we can keep them off the ventilator, because that's a bad thing to have to go to based on the numbers, as had just said. But if we can keep them off the ventilator, we can keep the watch on them, symptoms are still actually pretty bad for another week.
Now, I think I heard you talk a little bit about this at a conference call that we had recently for our Summit Urgent Care of Greeneville, which, by the way, we've adjusted hours short term. So in case you haven't seen my other post, our Summit Urgent Care, which is located at Dr. Nickle's office behind the Weigels on Justice Drive, right now in the evenings from 6 to 8 p.m., we're gonna have that walk-in clinic urgent care open. Our typical hours are 6 to 9 p.m., but at least for the next few weeks, we're going to do 6 to 8 p.m. We hope to open that up here soon. And then still on the weekends, hours are 10 to 3 on Saturday, 11 to 4 on Sunday. So brief advertisement there real quick. But where we're at was we were talking about the urgent care here this week, and I heard you talking about potentially treatments. Now, I'm a nerd. I do a lot of reading. I know that I don't know everything, and I think that's hopefully a strength in medicine is you get to a point where you learn so much that you realize how much there is out there that simply you don't know. And so then we have to rely on experts, people that know way more than even we know as physicians, to kind of help break this down as far as treatment options and all those types of things. Now, a few weeks ago, I got some some slack from putting the brakes on a few treatment options. I had talked about my personal concerns from a theoretical standpoint as far as hydroxychloroquine and azithromycin combined together. Some of those trials still won't be finalized, I know, for the next few months, but it seems like we shifted from where everybody was doing that to then there's some caution, and then we see one study come out and another. And just out of curiosity, have you prescribed that or any other medication, seen any success or any troubles, or what's the general protocol that you guys are doing now?
No, that's a great question. Actually, just in my month here, I think the protocol has moved multiple times, and it seems like it's constantly changing because we do have such limited knowledge. When I first got here, the hydroxychloroquine azithromycin combination was sort of the standard. But within a week, azithromycin really started going away. There were a lot of problems happening with that combination with heart-related issues. So the azithromycin went away because it wasn't showing in real-world time that much benefit or any benefit. The hydroxychloroquine kept on for a little bit, but as studies keep going, and of course the most notable study being the most recent sort of retrospective study showing increased potential death with the use of hydroxychloroquine, that really stopped it altogether here. So we are not using either of those medicines here. We have an amazing infectious disease team in this area that they are constantly on the research and on the numbers and what's happening. As far as treatments now, oxygen, of course, is the number one treatment. High flow oxygen as they get worse, and hopefully avoiding the intubation. Interestingly enough, a excellent treatment has nothing to do with medicine is proning, putting people on their bellies. It's really shown a significant difference for how people breathe. So between the proning and high flow oxygen, those are sort of the staples.
So essentially just using gravity to your advantage from a mechanical standpoint, where you have the patient on their belly, so instead of secretions going down in the lungs, you kind of do, I guess, what is the Trendelenburg or reverse Trendelenburg position, whichever that one is, where the head's a little bit lower, or how do you do that?
We keep flat.
Okay.
For the most part, it's just turning straight over on your belly. So, and there are actually teams in the hospital that go around and flip people.
Oh, wow.
So, yeah, because it has been a very effective treatment. So, but, going back to medicines, as far as medicines, the tocilizumab is one that is used, which is actually an autoimmune medication, sometimes used in rheumatoid arthritis. It's not a standard medicine. It's only with severe cases as they're starting to decompensate or get worse. It has a lot of potential difficulties because we do see a lot of secondary infections that are bacterial coming in with the COVID virus, particularly pneumonias. And if you were to give the toci to someone with pneumonia, it essentially shuts down your immune system. So you have a significant risk of killing you from sepsis. So
that was one of my early concerns as well, as far as the hydroxychloroquine. And by the way, as a brief political note for any of you watching, this isn't an attack on any political party or group. I'm a conservative physician, but the way Dr. Ken and I are talking right now, this is how doctors talk to each other. We get each other's opinions. We get each other's feedback. We don't really care what works. We just are trying to find what works and what doesn't work to try to help the patient the best we can. This is about saving lives. So this is not a bashing of our president or any kind of party or whatever else like that. With that said, that was my concern about the hydroxychloroquine. Was that hey, here's this medicine we use to treat lupus or rheumatoid arthritis, and it's known to suppress the immune system, which sometimes can be helpful, but in general, it's an anti-malarial medication, just like azithromycin is an antibacterial medication. And if there was ever a time to tell people, hey, antibiotics don't treat viral infections, this is a reminder. When you have your little head cold, like we always have a few times a year as physicians, I'm sure with exposure, we don't take antibiotics for those. We do supportive care, just like what we try to preach to our patients with these types of things. Antibiotics don't treat viral infections, but they can treat secondary bacterial infections. So each and every treatment we have is a tool, just like with the medicine you had just mentioned. And, I've been reading here recently, and it's gotten popular this week, about the remdesivir. Of course, just got FDA emergency approval. There was at least one study that I saw here in States that said there was a decreased days of symptoms by perhaps a few days, and what was trending towards a lower mortality rate. Now, the caution with that one even is too, is one study out of China found there really wasn't much of a difference with that particular medicine. Not that I believe or trust much of anything coming out of China, but nonetheless, that's what we do in medicine. We get our hopes up, and then we kind of slow down, and we get our hopes up and we slow down, and then we say, oh wow, that didn't work, let's keep looking. And keeping in mind that a month from now or 2 months from now, everything that we're talking about right now is probably going to be archaic. And we look back retrospectively and say, wow, I can't believe we were doing this on the 2nd of May. And just like today on the 2nd of May, wow, I can't believe we were doing hydroxychloroquine and azithromycin at the 1st of April. So right now, it's essentially we're doing the best we can. And we need, I don't know about you, but I think, yeah, we've got some really, really smart people working on this, some really smart industries, and I trust medicine. I trust our experts, and they may not be perfect, but like right now, I'm disheartened because of how many people are spewing out these conspiracy theories about who's moving all these different parts and who's funding all of this. And me personally, I don't know about you, but I don't care whether it's Bill Gates or Dolly Parton donating toward research. I don't care if the money's dirty. Let's get everybody chipping in, find out how to cure this and how to get a vaccine for it. But even already, I'm hearing so much anti-vaccine propaganda out there about something that hasn't even been approved for public use. The vaccine trials have started, and maybe it's out by later fall or winter. But to me, if you get enough people either that have had the disease through the natural process or the vaccine, if we can get people up to about a 70% rate where they've either had the vaccine or the actual disease, and that hopefully there's lasting immunity to it, which we're getting mixed response, that maybe this could be done. Do you have any thoughts there, or any recommendations for the average person out there that doesn't know who to trust here?
I think a couple things, just sort of finishing up that last part on those treatments. That remdesivir is being used here. Fortunately, it is a relatively safe medicine, but it has problems when it comes to people that also have kidney issues. It becomes a little less usable. But I'm glad you said about the immunity, because they are doing testing studies here with plasma of people with antibodies. Right. So that have had it, that have successfully recovered. That's correct. Yeah. So, that's starting to show some good response, but again, it is limited. So I'm not saying that's the perfect therapy, but ultimately, getting a vaccine would be nice, but I think this really gets back down to where we started, coming in a full circle. Ultimately, the best thing to do is avoid this and practice prevention. Yeah. As we do start to develop antibodies, I think hopefully it's going to show, like most other things, that we will develop an immunity and will not get it. But in the meantime, it's just a matter of right now trying to let the virus die out a little bit. And the way we can do that is just trying to keep people away until we can further develop medicines that are going to work.
Absolutely. That's, spot on. Exactly kind of what I've been working at here back home with a few of the projects we're doing is right now we don't know treatments. So the best treatment is prevention. And how to do that, you wash your hands. If you are going to be in close contact, you wear a mask. If you're a higher risk person or maybe around other people like in medicine like us, you come home, change your clothes, jump in the shower, other kind of things, just being smart and not fearing and living in so much panic that you're not living life, because we don't know when this is going to be over. This could be 6 months. This could be a year and a half. We just don't know. But you got to go live life. And I don't know about you, Ken, but I'm really starting to worry about people that are putting off medical appointments for chronic health conditions. From what I'm reading and just kind of general intuition on this, which is my own personal opinion on that, is that if you don't control your diabetes and your sugar is 200, 300, 400, for example, that's bad for the immune system as well, right? So when we see people get a urinary tract infection who has diabetes, a lot of times their sugar gets jacked up. And when that happens, then it's hard to treat an infection. Same happens with skin and soft tissue infections of the toes or the feet. And that's how diabetics lose limbs, for example. So what I'm worried about is people saying, hey, I'm not going to go into the doctor right now because I don't want to catch the virus. But also, what are we not treating? Are we going to miss that screening for colon cancer that found something earlier? Are we letting blood pressure get out of whack? Are we letting sugars get out of whack? Or other types of things that are making us less healthy, that if we do get this virus, there's going to be higher mortality and morbidity from it. Any thoughts or recommendations out there for what people should do or could do to help lower their risk?
Well, definitely, I think that controlling your other medical problems, we're just coming in and seeing the numbers in New York City area and around here of the amount of deaths that have started to occur from people that have been afraid to come to the doctors or the hospitals, the heart attacks, the hyperglycemic episodes. There are a good amount of people, and they're starting to sort of look at this now, that have passed away in their own homes because they were afraid to come out and get treatment. Just making sure to keep up with things. Controlled diabetes is not necessarily a large risk factor, but I can tell you uncontrolled diabetes is more than 50% of the people I see. So that is a very huge problem. So controlling the diabetes is big. And again, going back, please, everybody, just look at CDC recommendations. The mask is not, the only answer. And the mask really is for if you're going to be in close contact for more than 5 minutes with a person, unless they're coughing or having other problems. So anyone that's coughing should be using a mask. But otherwise, I'm a big advocate to please get back outside and live life again. Just do it again in that safe fashion.
Well, very good, Ken. Well, I really appreciate all your insight. I'm looking over here at comments right now, and a lot of people said hi and those types of things, but I don't have any direct kind of questions here for you. But I think we've hit all the highest yield things, at least that I was thinking about. And once again, I appreciate your insights, because at this point we've talked about, to take this serious, but not to panic, to live life, but not recklessly or irresponsibly, to prevent the best way we can. So not only if we're young and healthy that we don't get this, but that we don't take this to our maybe our parents or our neighbors or someone else who would otherwise be at high risk of dying from this, that young healthy people can get this. And of course there's a financial cost to that. There's a health insurance, a lost work potential, and other kind of intangible types of costs, but also we needed everyone to buy in to help protect our most vulnerable, which sometimes is an older person, but it sometimes is someone that's your age or my age that has underlying health conditions that are invisible to the average person, but just that concerning. So we briefly touched on treatments, which is essentially there's a few promising things. Potentially we'll know more in a few months, but right now there's no game changer. There's no silver bullet. There's just prevention and mitigation. And I'm hopeful that hopefully over the next few months, we've got a better answer of how to treat it. We've got better answers of where it is and how much prevalence that is out there. We've got more progress onto a vaccine that we can hopefully convince people to buy into from a herd immunity standpoint. We have better access to masks as an entire nation, better access to hand sanitizer, and that hopefully by the fall, if there is this round two, that we're going to be over prepared. And even if it doesn't hit like what it could, that some people are predicting, that eventually with 7 billion people on the planet, eventually there's going to be something like this in the future. Not that we need to live in fear, but we need to be prepared. Any thoughts as far as what we could do as a community to prepare going forward?
I think really, we've sort of hit on all the big things already, and it's just a matter of watching out for each other and thinking not just of yourself, but those around you. Obviously, you want to keep yourself healthy, like we talked about, so keep your own medical problems, if you have some, on track. Try to make sure you're doing the right thing for your own health, but then again, like I said, and you've been saying, keep in mind your parents, your grandparents, the other people in the community, that we want to make sure we keep us all going forward nicely.
Absolutely. And one thing I've been telling all my patients is there's never been a better time to quit smoking than right now. And I think that's something that I forget to say on here often, but I'm really pushing that with my patients in my clinic. I'm sure you are too, of saying, hey, listen, if you smoke, you're twice as likely to have routine sicknesses, or when you do, that you're gonna get more sick. When you quit for 3 days, there's relaxing of the bronchial tubes. When you're quit for a few months, there's start to improve in actual lung function and lung capacity too. So great time to quit smoking. As you said, great time to get outside, get some fresh air. One thing I'm working on as a big guy myself is getting out there and exercising more, almost preparing my body for having to go through those types of things. So once again, Dr. Ken Nickle, one of my Summit Medical Group colleagues here across town. Even though we're at different offices, we're still in the same family. So thank you, Ken. Thank you for all your hard work on the front lines, for putting your own life potentially at risk to help those in need. And thank you for your service, obviously, through the Army here as well. Please reach out to me at any point in the future if we need to do a round 2 of something like this for new updates or new information. Or if you're just sitting at home late one night thinking, oh man, I wish I'd said this, jot that down, get it to me, because I'm really trying to get the best, highest quality information to people here locally to be able to know, okay, what is it really like? Because what you see on the news, it's always going to be one extreme. There's always going to be spin, but the truth always lies in the middle. So thank you very much for your truth today, Ken, and you have a good day.
You too. Have a great one.
All right. See you later.
Bye now.